Kathryn, you're on a mission to reclaim public understanding of dying, which we are 100% here for. Why do you think that here in the West we find it so hard to talk about death?
I suspect it's partly because we've forgotten about what dying looks like. And I
Mm.
think that when we understood it better, perhaps we didn't talk about it anymore, but it wasn't secrecy. It was simply familiarity. So why would you talk about it? And so I think we're kind of victims of the wonderful advances in modern medicine in high income countries, where once upon a time we would have stayed at home and looked after our dying person because nothing could be done to prevent them dying. Now
Mm.
hospitals have got all kinds of things that they can do. And so we send people who are sick enough to die into hospital in the hope that they won't die. And of course, sometimes they don't, which is fantastic. But it means that we've lost the familiarity with the process. We've lost familiarity with being responsible for being the companions of that process. We've kind of delegated all of that to medical staff, nurses, and the teams around them. And we don't see the ordinary process because it now gets complicated by all of the medical stuff that goes on to try to prevent the death. So instead of saying goodbye and, beginning our mourning around the deathbed, people are living in hope that life might be snatched out of dying to the last possible minute. So they're less prepared. So I think we don't know how to talk about it because we don't really know what it is that we're talking about. So I was a young doctor. I've been qualified for a few years. I've been aiming for a career in oncology. So I've been working in hospitals and I'd chosen the places where the sickest people were. So, emergency departments, intensive care units, the regional leukemia service. So I'd seen lots of people dying of a variety of causes. And eventually got the job that I really wanted, which was in the oncology centre. Hooray, I've made it. And then found that actually I was more interested in the people who weren't going to get better. Finding the cure for cancer didn't seem that exciting, really. It seemed to be mainly waking people having chemotherapy up in the middle of the night to take their blood and centrifuge it and then draw graphs of the results. And, I know it's important, but it just didn't do things for me. But getting the symptoms right for people whose time was precious, that was really interesting. So about the time that I was making that transition, a hospice got built in my city within walking distance of my house, which kind of seemed a bit like a sign from the universe. And I went to work there. So the context is that I'm a fairly experienced but still very junior doctor, and I haven't been working in a hospice very long, when Sabine, the most terrifying patient I think I've ever had, because she was so French, she was so chic, and she just did not suffer fools gladly. She confessed to the nurse that was looking after her that she was terrified of dying in case she had horrible pain as she was dying, because that pain might lead her to despair, and despair would be a mortal sin because she's a French Catholic. And if she died in a state of mortal sin, she wouldn't get to heaven, which is where her husband, who died a few years ago, was waiting for her. So this is a huge existential sorrow and fear for this amazing woman who'd been a member of the French resistance. She wasn't frightened of much, and now she was frightened. And the nurse came and told the young medical director, my boss, and he said, oh, well, we need to go and talk to her. And so the story is of his discussing with her what to expect. And he took me with him, and I sat on a little stool and I just watched this conversation with increasing discomfort, because he started off by saying to her, I heard you were very worried about being overwhelmed by pain as you're dying, which isn't the most subtle intro, is it? But actually, because he was fluently bilingual and spoke French, he often would sit and just chat with her in the evenings. And she was a bit flirty with him, which was rather sweet.
Mm.
So they knew each other really well. And he could just, go for it. So she said, yes, she was frightened of that. And I thought he was going to talk to her about pain. And the next thing he said was, I wonder whether it might help you to feel slightly more at ease if I describe to you what happens as people are dying. And I'm thinking, wait, what? You can't do that because, I'm 26, which is the age when you still know everything. And I'm thinking, I've seen lots and lots of people die and it's never the same twice. So how can you tell her what's going to happen? And she said, yes, she would like that. So then he said, well, look, the thing is that it doesn't really matter what the illness is towards the end of somebody's life. The main symptom that we notice, the main change that we see is that people are more tired and they need more sleep to recharge their batteries. Their energy runs away and they find that they are alternating between sleeping and waking through the day to keep their energy levels up. And you might even find that that's happening to you already. And she gets hold of his hand and she says, yes, that's happening. And he says, oh, okay, well, that's good. And I'm thinking, oh my God, no, that's not good, because that means that she's starting to die. And he's going, well, so that's good, because that's telling us that you're following the normal pattern. So let me tell you the next bit of the pattern. And if you want me to stop at any point, I promise I'll stop. And I'm sitting on my little stool thinking, what's he going to say? So he says, so the thing that we expect now, Sabine, is that as time goes by, we see people get more and more tired, they sleep more, they're awake less, until eventually the person is just not waking up at all. And in fact, at that point, they're not even just asleep, they're unconscious. Do you understand? Do you want me to say it in French? And she's saying, no, I understand, unconscious. This is what happened to my husband, yes. And he says, so once people become completely unconscious, the only bit of the brain that's still really doing its normal work is the bit that drives our breathing. So unconscious people breathe in a really unusual way. It's cycles that move backwards and forwards between really deep breathing and very shallow breathing. And sometimes it's quite fast and then it gets slower and slower and slower. Then there are pauses. And then it goes back to the beginning, gets fast again. And by now, she's kind of sitting up in bed. She's looking at him, her eyes on his eyes. She's nodding, she's stroking his hand. And I'm sitting on my stool thinking, oh yeah, that is what happens. How come I've seen this hundreds of times and I've never noticed that before? And so, okay, so he's explained to her that she's going to be unconscious, so she doesn't need to worry because she's not going to be overwhelmed by pain. We can go now, can't we? And he's still going, and I suddenly realised, oh my God, he's going to the last breath. So he says, there's periods where we see people are breathing quite fast, but it's quite shallow. And if their families haven't seen that before, they might think that they're, panting, breathless, working really hard to breathe. So if your nieces and nephews are here, we'll explain this is normal breathing in people who are deeply unconscious and you're completely safe and they don't need to worry about you. And sometimes breathing is slow and deep and it's through the back of the throat where the voice box is and people don't feel the back of their throat anymore, so they might make noises as they breathe. And families worry that the person's trying to speak or they're groaning and uncomfortable. So again, if that happens, we'll explain to your nephews and nieces that you're completely safe, that this isn't distress. And then usually in one of the slower periods of breathing, there'll be a breath out. And he looks at her and she looks at him. And there's this pause and he says, but just doesn't have another breath in after it. It's as gentle as that. There's no sudden rush of pain, feeling of fading away, no panic. It's very, very gentle. And you can see she closes her eyes, she drops her shoulders, she's still stroking his hand, but she lies back on the pillows. And she says, thank you. And I'm sitting on my stool thinking, oh God, what just happened? That has exploded my mind. She kind of waves her hand, waves her fingers in that dismissive way of, okay, you've done your job, now off you go. And as we're walking down the corridor, I was too overwhelmed to speak. I'm sure I was probably crying. And what was happening in my head was two things, really. One was I have watched hundreds of people dying, but it was my job to stop them from dying. So I was so busy thinking about their oxygen levels and their hemoglobin and what their kidney function was like, what was their heart rhythm, that I hadn't just kind of taken one step back and looked at the global thing that was happening, to recognise it. But as he'd been describing it, it was just coming to life in front of me that, yeah, I have seen this. He's absolutely telling the truth. I really recognise this. But I think the other thing that was even more astonishing, and it's the reason we're talking to each other now, was that understanding that not only can we understand and describe this process of dying, but we can describe it to a dying person, and it's consoling. We can give people that gift. And what's gone on in my career, so that was, I don't know, 1986, so a little while ago, is that I've gradually learned to have that conversation with patients, with families, with worried people on a bus. You know, it's relevant anywhere. And I always remember to say, like he said, look, if this gets too much, you just say and I'll stop. And nobody has ever stopped me. But at the end of it, there's always that moment of, like, she closed her eyes and she relaxed and she said, thank you. Usually it's that kind of pause, and then that's just not what any of us is expecting. Will you tell my people? She had no people left to tell. But, you know, will you tell my kids? Will you explain to my spouse? Will you tell my parents? Because they need to know that, because they're so worried. And if that's all it is, I think we can manage that. And I realised that when I qualified from medical school, I was 23 and I knew all about saving lives and nothing about dying. When my nana was 23 in 1923, so she'd been a teenager in the 19-teens, she was so familiar with looking after dying people because she and her sisters and her girl cousins would have been told by her mum and her aunties how to look after people, steered them through the process, explained what was going on, what to expect next. She knew it inside out when she was 23, and she knew it by seeing it, by being up close with it. So I realised that if there was a way of giving it back to people, they had to see it, in their minds as though they were there. And the way you help people to do that is that you tell them completely captivating stories so they feel as though they've been in the room. And that's how the book was born.